Ding, ding, ding. You're awoken by the sound of a hospital bed's alarm. The whirring of medical equipment fills the room, and you find yourself in a sterile environment with the words doctor and nurse scrolling through your foggy mind. But have you ever noticed the stark contrast in bedside manners between physicians and nurses? Let's dive into this medical mystery. Why is it that physicians tend to lack the basic compassion that nurses seem to exude effortlessly? Picture this. Dr. Stone Cold walks into the room, clipboard in hand, barely making eye contact, while Nurse Sunshine floats in with a warm smile, kind words, and a gentle touch. It's like witnessing a showdown between a robot and a human. So what gives? The physician predicament. Compassion on a call. Have you ever felt like you were talking to a walking, talking medical encyclopedia when interacting with a physician? That's because their training often focuses on the clinical aspects of patient care rather than the touchy-feely stuff. The pressure of diagnosis, treatment plans, and staying on schedule can sometimes turn a caring doctor into a hurried professional zipping in and out of rooms like a race car at the Indy 500. Image source. The nurse narrative. Compassion is their superpower. Now let's shift our focus to the unsung heroes of healthcare, nurses. Compassion isn't just a value for them, it's practically their middle name. Nurses are trained to provide holistic care, which includes emotional support, active listening, and genuine human connection. They are the glue that holds the medical tapestry together, empathizing with patients and their families through every peak and valley of the healthcare journey. The compassion conflict, bridging the gap. But wait a minute, shouldn't compassion be a universal language spoken fluently by all healthcare professionals? Absolutely. While nurses are often praised for their innate ability to nurture, doctors can also tap into their compassionate side with a little practice. After all, a warm smile or a reassuring hand on the shoulder can sometimes work faster than any medication in the cabinet. So why does this compassion conundrum persist? Let's unravel the mystery, shall we? Walk a mile in their scrubs. Imagine a day in the life of a doctor. Rounds, consultations, paperwork, emergencies, the list goes on. The pressure to juggle multiple tasks while maintaining clinical excellence can sometimes overshadow the softer side of patient care. It's not that physicians lack compassion, it's just buried beneath layers of responsibility and stress. On the flip side, nurses have the unique opportunity to spend more time at the bedside, forging deeper connections with patients. Their hands-on approach to care allows them to see beyond the medical condition and into the heart of the individual. It's like they have a superpower that lets them decode the language of pain and fear with a single glance, a prescription for compassion. So how can we remedy this compassion imbalance in healthcare? It starts with a healthy dose of awareness and a sprinkling of empathy. Physicians can benefit from actively incorporating compassion into their daily practice, taking a moment to truly connect with each patient on a human level. Nurses can continue to be beacons of kindness, leading by example and inspiring their colleagues to embrace the power of compassion. Remember, at the end of the day, we're all in this together. Patients, healthcare providers, and even medical robots. Let's strive to create a compassionate ecosystem where kindness reigns supreme and bedside manners sparkle like sunshine on a rainy day. In conclusion, the bedside manners of physicians and nurses may differ, but at the heart of it all lies the universal language of compassion. So the next time you find yourself in a hospital room, take a moment to appreciate the intricate dance between clinical expertise and heartfelt care. Who knows, you might just witness a miracle, the fusion of science and compassion, creating healing magic in the most unexpected places. Note, let's lace our stethoscopes with a touch of empathy and sprinkle some humor in our medicine, shall we? Laughter is, after all, the best medicine.